All right, welcome everybody to the podcast series on innovative healthcare solutions sponsored by the Conference of Consulting Actuaries with the CCA. Just as a reminder, if you haven't seen any of the other ones, this is a series of interviews that we have with professionals focused on delivering innovation in healthcare. And I'm sure you'll enjoy this session and all the great discussions we plan to have highlighting the interesting people, products, and services designed to drive a better healthcare system. Now, just as a little reminder to the actuaries in the audience here, that these sessions are really offered to provide insights about what's transpiring in the ever-changing health environment in which we live. So while these sessions are not necessarily designed to offer continuing education credit for actuaries, each viewer can assess for themselves if it meets the criteria for such credit. My name is Ed Podlosky. I'm president of Morningstar Actuarial Consulting. I'm also the chair of the healthcare community with the CCA, and I'm going to be your host today. I'm really delighted to be joined today by Jeff Dobro. Jeff is the Chief Innovation Officer at Transcarent. Jeff is an MD and a fellow of the American College of Radiology. Prior to joining Transcarent, he was the Chief Medical Officer at One Medical Group as well as Redbrick. And he was also a consultant at Mercer and Willis Towers Watson. So Jeff, thanks for joining us today.
Ed, thank you so much. It's a real pleasure to be with you.
So Jeff, I don't want to put a lot of pressure on you. We've interviewed.
Sorry, could you say that again?
Oh, well, there goes my phone. Sorry about that.
At least you know it's real.
The technology is great, but it just kind of went off for some reason. Jeff, I don't want to put any pressure on you. We've, interviewed chief medical officers. We've interviewed data scientists as well as some, pretty senior actuaries in the field. But you're the first interviewee we've had with the word innovation in their title. So expectations are high for this one,
Well, look, the healthcare system is really ready for something new and different. So, innovation is what we're trying to do here. Thank you.
Excellent. Jeff, in some ways, Transcarent is both new to the market, but, it's been around in various forms as well. Can you help our audience understand, not only who you are, but, how you plan to reshape the employee healthcare benefit experience?
Exactly. If you think about the confusing and really complicated and costly system that we have, we, as well as you as actuaries and pretty much anybody else who's been involved in the healthcare system, recognizes that it's just not serving our people, just regular old everyday people as well as it could. So what we're really trying to do here is to create a very different kind of health and care experience, something that feels simple, almost like hitting the easy button for healthcare. If you can imagine, there could be such a thing as healthcare being easy, making people feel that they're cared for, that they've got trusted guidance. And it just feels like, I like to think about it, if they had a friend in their family that actually had information and knew something about how the health system would work, they'd help guide them around the system and then get them into the right places at the right time, the right cost, with somebody who actually really did care. So that's what we're trying to do, bringing transparency and a much, much, much better and different experience out to the average everyday consumer.
So, Jeff, as I mentioned in my introduction, you've been with a number of innovative solutions in the past, One Medical Group and Redbrick. What intrigued you about Transcarent to want to be part of what they're doing in the market?
Sure. For such a long time, myself and the consultants and employers and just others have taken little pieces of the system and tried to make them better. But we've never really had access to information. We've never had the technology that allows us to understand the way that the system is working, understand people's health, understand providers in a way that actuaries would understand. We can really look at quality and cost efficiency in ways that we've just never able to do it before. So having been, you mentioned, Ed, that I've been at Mercer and I've been at Towers, looking at the numbers, looking at the programs, working with self-insured employers, working with health plans, and we've never quite had all the tools that were necessary to really change the system. Now it feels like all of that is there. And this feels like a tipping point where hopefully with the right effort and the right design and the right partners, we can really make a change that's just not been possible to make in the market before.
So that sounds like a pretty big lift, Jeff. So, how is Transparent going to utilize, digital technology as an example? I think you mentioned that to really drive your approach in building out your solution and value for your clients.
Sure. We use technology and human beings to help understand what an individual person's circumstance is at any given point in time, and help them understand what they can do for themselves so they get care on their own terms when they want, when they need it. What we have is access to data that we've never had before. One example is around the way that we look at provider quality. It's always been very subjective for most people. They go on whatever Google or Yelp and find out what other people have thought about the experience. And Ed, I don't know about you, but I would not want to be getting my heart surgery on Yelp. That's maybe I get a hamburger on Yelp, but not my heart surgery. But what we've been able to do is access really, really excellent data sources to look at things like appropriateness of care. Maybe people have heard of Choosing Wisely or Practicing Wisely, where the professional medical societies have worked with consumer organizations to understand what's the right thing for a doctor and a patient to do in a given circumstance, whether it's following guidelines or there's just many different inputs. Well, that's one of many inputs in the way that we look at quality, one of the data sources. We also look at things like outcomes. We look at like clinical outcomes, are people getting infected, falling out of bed, having pain after they have surgeries. We also look at the volume of procedures. We look at patient ratings, and we look at things like patient-reported outcomes. Did people really feel better? And did they get their problem solved a month, 2 months, a year later? All of that goes together in our quality algorithm. Then we combine that with what we call cost efficiency. So not just looking at unit costs, which is really not a very good tool to understand how to impact the total cost of care. But we look at cost efficiency, which would say, Dr. Ed versus Dr. Jeff with a similar panel. How do we do in taking care of our patients? Is Dr. Jeff getting 15 MRIs for everybody that's got back pain? And Dr. Ed doesn't need any MRIs. He just gets people better. How did that happen? But he just does. So we put all of that together, and when we look at our value equations and our value algorithms, we've got all of these different elements from many different sources around quality. We bring in cost efficiency. We present that to our members, to the consumers. We let them weigh what's important to you. Would you rather have a great experience and not maybe such a great outcome? Or would you trade maybe the best back surgeon who's maybe not so friendly, but you're going to get a great outcome? And you get to weigh that yourself.
Yeah, well, let's hope they're using that instead of Yelp and Dr. Ed. Oh, I'm sorry, Jeff, I didn't mean to cut you off.
No, you're exactly right. You're exactly right. But we have that. We also have other data where we have claims data, which your audience will know is not the easiest thing to get access to. But we do use claims data to look at patterns of care, understand how to risk stratify and segment a population. We combine that with some, not really social determinants, but more like maybe commercial and demographic data to best understand how the members perceive themselves, their health, look at additional risks beyond what you might just identify from a claims file. And we put that together in our engine that helps guide people through our ecosystem to find the next best step for them. In addition, we're capturing all of the data around each action that a member has as they're going through the system and looking at what the outcome, what happened after they used our telehealth, or what happened after they used the provider finder, or really any of the tools. And then lastly, Ed, I would just say we're using artificial intelligence, not in the buzzword kind of way, because everybody has, AI-powered breakfast cereal. I don't know what they have, but it's, everything is AI-powered now. But what we're trying is really to bring in the data that we have and use that member or that patient's experience to help best figure out what is the next thing that they could be doing that would be of most benefit to them. And we use data in so many other ways, but I thought I would just capture a couple of examples there for you.
No, that's great, and I appreciate you sharing that with us. Maybe you can help us understand, so you talked a lot about using the technology and the data science to kind of drive your approach. But how are you actually then interacting with the member to, to have an effect on the change that you're looking to make?
Sure. So what we did is we identified the most common ways that people, just regular old people, now interact with healthcare technology. And they do things like look up their symptoms in Google, which I will share with you as a doctor is not a very good idea, but people do it every day. And this is just an example. And what we do is we've got a very highly curated, I'm going to say pretty accurate as an average primary care doctor, but it's just a digital tool for somebody to come in and say, I have a cough, and in 2 or 3 minutes, it goes back and forth, just from a chatbot perspective, querying the individual symptoms, duration, severity, things like that. And it gives them a probabilistic listing of what's likely to be wrong with them. Now, that is pretty common. What we do is we take that information and say, given what's in this list of probable issues, would you like to find a doctor that is an expert in that particular issue? Are you concerned because of the severity that we've identified from that chatbot? This is actually something you probably want to talk to a doctor right now, and it links you right into our telehealth service. And if it's really urgent, it says you better be calling 911 right now, or talk to one of our health guides, and they'll help you get medical help like right now. Other options may be, hey, it's not so urgent. I'd love to have, I don't know, maybe a physical therapist or a physician's assistant come to my house and check me out. There's like something going on here. I don't want to go to the ER. And we know what that's going to cost. An avoidable ER visit's going to cost what, like $2,000, $2,500 by the time you're finished with your facility fee and the CAT scan that you didn't need and the blood tests and everything else they do for you. If we can avoid even one ER visit every couple of times somebody uses the system, there's quite a bit of cost savings that's in there. So the technology will pick up somebody wherever they start and then guide them through the process. Another example, Ed, might be somebody is looking in a provider finder and they're looking up orthopedic surgeon, and then we know they've already been looking up back pain. They go, based on what we know, this is somebody that is likely to start to get into the orthopedic surgery realm and is probably going to consider at least back surgery. And since we know from lots of studies that about half the back surgeries don't end up really helping somebody, let's guide them maybe into an expert opinion, or at least let them talk to one of our nurses or even one of the in-house doctors and explore what might be going on with them, not to make a diagnosis necessarily, but how do we get them to a really great orthopedic or back surgeon that's not going to operate on everybody. We talked about appropriateness of care and that tool set. So all of these different tools and these pathways are all connected, and the member doesn't even necessarily know that all of these digital connections have been made. Well, they know it's like, gee, Ed, sounds like, you got a back problem there and you're looking for an orthopedist. Here's somebody that we recommend for you for these reasons. They're going to be nice to you. They get great outcomes. They're not going to operate when you don't need an operation. And look at that, they're right in your neighborhood. Wouldn't that be great? So that's how we use the technology. At least that's one of the ways. And if somebody says, oh man, I already was recommended to get surgery and they could use their system, they go right into the Surgical Centers of Excellence finder and they go, oh, wow, look at this. There's actually a spine center of excellence. It's not even too far away, or maybe I would travel if it was even better than what's available in my neighborhood. So that's how we use technology. There's a lot of data, a lot of information that's out there. And look, as a physician, this is how I would be thinking about helping a patient anyway. So when we can embed all of this in the technology, it just makes it easier, faster, yet we leave people, our health guides or nurses, as another option for a member that wants to talk to a real person. Developing that personal relationship is pretty important for a lot of people.
So Jeff, you've talked a bit about, how you're helping guide the member kind of through the healthcare system to drive efficiencies and effective care. What are some of the things that you're doing on the provider side to drive that? Because that's the other part of the equation in all of this, right?
Yes. Well, a couple of things. One is as that bridge between the member and the provider. I mentioned that we do use all of the data that we have to help guide the members to, we'll call them higher value providers to start with. And we know that, half the doctors are above average. Didn't take an actuary to do that kind of math. Even I could figure that one out. And just doing that alone, guiding people into higher value, higher quality, more cost efficient providers is a good thing. But we don't want to keep that information secret from the doctors or from the hospitals. We would love to create the Lake Wobegon of healthcare where everybody's above average. That would really be the best for us. And, this is not just about our members, but, we want to see rising tides, floats all the boats, or whatever that phrase is. So we do share this with the health systems and the doctors that we work with. And you may know that we work directly with a number of large health systems across the country. And in fact, they're eager to get independent information about how their hospital or their therapists or their doctors or their psychiatrists or whatever it is, they want to really know how their own providers are doing. And so do the individual doctors. Doctors, we're a really competitive bunch. I mean, that's what it takes to make it all the way through college, med school, residency, and all of that. And all of us really want to do a good job. So if there are things that we're doing that we shouldn't be, or things that could be done better, most doctors, not all, but most doctors want to know. So we're very free to share all of those data points that I shared with you, that we share with the members. We'll share it with the health systems, we'll share it with the doctors, and we really want everybody to get better.
So Jeff, quick question, and you talked about a lot of the data that you're sharing with the providers and with the members as well. What type of information are you providing back? I mean, your clients, I assume, are kind of the large self-funded employers out there, and what information are you providing to them to help them to understand the value that TransCare's bringing to them in that relationship?
It's very interesting that you mentioned that. Just earlier today, I was on with one of the lead measurement people from one of the major consultant houses. And they were telling me that they've actually gotten most of their clients to move away from a strict ROI. And, the reasons are obvious. Not everything that brings value is going to bring economic benefit, particularly in the short time horizons that many HR executives have in mind. She was just sharing the story that one of her clients put in a new program. They had vetted it for 6 months, gone over every element. The implementation was very careful for another 6 months. And then 6 months into the program, the employer asked this actuary to calculate the ROI. And the actuary just had to respond back. It's like, I will guarantee you don't have to pay me any fees at all. There was no ROI in 6 months. Your people are just even finding out about this program. So let's set up a measurement strategy that looks at what the natural progression of any kind of a health or health management program is. First, people have to find out about it. That's a good thing. So let's measure that. Then they actually have to start to engage. That's a good thing. Then they should be really working on some kind of initiative that's relevant to them. We can measure that also. Then we can look at things like health outcomes. That's actually a good thing too. And then we can eventually look at that return. And I think, what do they call it? Their value impact model, which is quite a novel way of evaluating the impact that any kind of a health or health management program is going to have on a population. So that's how we do our measurements anyway. We report out to our clients. We look at initial, we call it activation, just getting started. But that's not enough to drive success just because people call a health guide or, enter their information on an app. I mean, some people maybe feel empowered by doing that, and they'll take better care of themselves. But we're really looking for that next step or next steps. Like, what did you do as a member after you signed up? Did you find anything of value? Was it appropriate for you? So that's the next thing that we measure. We look at engagement and we report that. And then, because we have such a wide range of health solutions that a particular member could engage in, we report all of them separately. But then one of the things that you mentioned at the beginning, we're taking a big bite at a really big apple here, is we try, because everything is curated and connected to each other, we try to look at this program in totality to say, I don't know, if I went to a surgical centers of excellence and I went to a therapist and maybe I use telehealth, what does that particular combination do for me? Or what does it do when we have larger numbers of people who have used different combinations of services? And we report that out to our clients. We try to show them these particular areas are having bigger impact than other areas that may or may not be, appropriate for that population. And then eventually, like everybody else, we report ROI and say, here are the dollars. Some of the issues that we have around reporting in this value versus, ROI concept is some of these initiatives have an immediate impact. If I went to a better surgical center of excellence and had a bundled payment and it's going to cost me 35% less, well, that value was created the day that individual had surgery. If we're then talking on the other hand that we have somebody who has mental health issues and isn't showing up to work very often or isn't productive or has some other medical issue, and this is a comorbidity, we could be very, very effective in helping that person work through their mental health issues. We might not see $1 saved for 2 or 3 or 4 years. And then you can imagine everything in between. So we also try to create this kind of time sequencing of value as we report that out to our clients as well. I don't know how successful it is. Our clients like yours are under a lot of pressure to keep healthcare costs down, and they often want to know, what is my 6-month ROI, which there is none. But at least, they may be focusing on short-term as well as those moderate or longer-term results.
Yeah, I think it's important, as you said, not only to kind of focus on the financial value, but also, what are the activities that they're leading to? Because like you said, in this arena, it is so difficult to try to evaluate success just on any one measure. Hey, Jeff, this has been a great discussion. I'd like to end many of these just with kind of a little more of a personal question, if you don't mind. But if you hadn't been doing this for your career, going into the medical field, what would you have really taken up? What would you have liked to have done?
Oh my God, and that is a very funny question. So my guidance counselor in high school asked me the same question. And here's a funny answer. I don't know that I would have done either of these things. But I said, wow, I want to be a doctor. I love helping people. I love science. And there's a business to it that's kind of goofy to me that I think could be better someday. So that's what I decided to do. And she said, well, what else would you do? I said, I don't know. If I wasn't a doctor, I don't have any burning passion. But if I didn't want to work really hard and maybe I'd just wake up really early and be done with my day at 2 o'clock, I'd be a garbage man. And I would just run around picking up the garbage. Right? Very low stress job. I said, either that or maybe I would be the president of the United States. Because, if you're really going to commit to changing the world, that would be a place that you could really do it, maybe.
Well, that business certainly is one that's always picking up. Sorry, bad joke. Hey, Jeff, I mentioned at the start of this that, the expectations were high, but you really delivered on it. So I really kind of enjoyed the discussion today. I'd like to encourage our viewers who also participate in the CCA healthcare community, continuing discussion about the insights shared here on that platform. And, if you're not a member of the CCA and you want to consider joining to not only experience the benefit of community platforms of the CCA for informal discussions like around this, but also some of the other great benefits that our members enjoy. Jeff, thanks again for being here today and sharing your experiences about what TransCareN is doing to drive innovation in healthcare. I know I benefited from this, and I'm sure our audience did as well. So thanks again.
You're very welcome. And Ed and your audience, let's get out there and transform this healthcare system. It can be better for all of us. Let's do it.
There you go.
All
Thanks
right.
again.
Thanks a lot, Ed. Bye-bye.
Bye.